So here we are at Covered 6 training facility. This is one of the rooms. This is actually our Omnia room. So our Omnia room is what we use for any nightclub settings. As you tell with the video, there were strobe lights and disco lights, and this is a very open setting. So this is what we would use for any nightclub settings or discos or anything like that where there would be a gathering of a large amount of people and then a low light setting in general. So what you saw just happen here is what we're going to go to now into our March algorithm, which is H, which is head trauma. Okay, so we just saw something very common, which is a fight in a club or even at a bar. All right, in a crowded area with low light visibility. So our player got knocked out, and just from the punch alone, of course, we're always worried about the head trauma just from the punch, but what we really want to know is how the head was affected when it smacked the concrete or the ground itself. Because he wasn't able to brace his fall, he went straight back, and then his head probably bounced off the concrete. And then from there, you're almost at the mercy of whoever your attacker is. Because if they start stomping you out and you're unconscious, you're not allowed to defend yourself, and you're just taking one shot after the next. And this is where a lot of damage can come into play. So in this setting here, when we talk about head trauma, if he's laid out, of course, this is again where we want him, is flat on his back. If he's laid out, one of the biggest things I care about here is actually scene safety. Because we're at a nightclub situation, low light. If I can, I'm gonna try and get them to turn the lights on. And I want every bouncer possible trying to pretty much make a barricade around this guy. Because I don't wanna move my patient, okay? I don't know what type of damage was done in terms of his neck once he hit the ground. I'm really wanting to determine whether or not my patient is conscious, confused, all right, alert, anything along these lines. These are some of the basic things I wanna know with head trauma. So I really want all the bouncers, if possible, to sort of form a barricade so I can actually help my patient. I want to try and turn the lights on so I can get a little bit of visibility so I can actually see his eyes and his head and any other wound he might have incurred on the way down, because of course we're on a club scene. There could be broken glass or beer bottles that he also might have landed on as well. So I always want to make sure that his surface around him is safe and that the areas also became safe. So again, I can't really give medical treatment if I got like 6 people still trying to stomp him out. So if the bouncers can actually just create like this nice little barricade around them, then I can actually go and try and help my patient. So from here, what I'm actually gonna do is, we're done talking about head trauma. I know he took a shot because he's laid out. If my patient is unconscious, then what I'm gonna try and do is just simply check for any secondary wounds, all right? I might raise his pupils up a little bit just to check to see if he has any blown out pupils, because this is very bad, all right? Or if he's bleeding out of any area in general, or if there's blood around his head, okay? That's always fine, because if my patient's unconscious, then I don't have to worry about him moving. It is scaring me because I always want my patient to talk to me, but in terms of any neck or spinal damage, if he's unconscious, then he's not moving, then we can just wait it out a little bit here. I can try to keep him stable and deal with any other wound that he may have. If my patient is conscious, but confused, this is where a little bit of more of a problem can come into play, because he may start to try and sit up and he might not know what he's actually doing. Okay, so it takes away from me actually being able to stabilize the neck and the spine the way I want to, and he might start causing a little bit more damage to himself. So the best thing I want to try and do is always just keep my hand here. So if he tries to sit up, I can just sort of give just a little bit of pressure to let him know I need him to lay back down for me. And then of course, just try and talk to him as best as I can. I've checked his radial pulse. He does have a good pulse. I always go to his radial pulse first, because if there's no pulse here, then we're in a lot of trouble. Okay, but if he does have a pulse here, then we're good to go in terms of shock. 2 of the biggest things for shock is a decreased level of consciousness and an absent radial pulse. Now, we already know he got his bell rung, so I don't want to move my patient. He's already in a good position. If he starts to remain, no, there he goes. Hey, lay back for me, okay? So my patient just regained consciousness and he tried to move. And do me a favor, okay? My name is Kirk, I'm a medic, okay? Can you tell me what your name is? It's okay. You know where you're at?
No.
No? All right, so let me tell you something. You're in a bar, all right? I'm gonna help you out, is that okay?
That's fine.
Okay, all right, so you fall a little bit, all right, and you hit your head. Is that okay? So I know you try to sit up, but I actually need you to stay right here on the ground for me. Is that good?
That's fine.
All right, so just stay on the ground. Does anything hurt?
My head hurts.
Your head hurts? Okay, are you seeing blurry vision?
Yeah, a little bit.
A little bit? Okay. Do you feel nauseous?
A little bit.
A little nauseous. Okay, so if you feel like you have to puke, you just let me know, okay?
Sure.
All right. So I don't want him to try and know that he was just in a fight, because he might elicit an emotional response. So if I just told him like someone beat his ass, He might want to get up and fight back, and that's not what I want. So I'm going to simply tell my patient, like, hey, listen to me. You fell in the club, okay? I'm here to help you. My name is Kirk. I'm a medic. I've already called 911, and paramedics are on the way, okay? What I need you to do for me is just lay down for me, okay? And just stay where you are, all right? Yeah. Okay, good. And then I'm going to start talking to him. I'm going to ask him if he's in a pain, all right? I'm going to ask him whether or not he's having a hard time seeing or he's having headaches. So blurred vision, slurred speech, does he feel nauseous? These could all be signs of a concussion, especially if he's feeling nauseous. If he's feeling nauseous, he might vomit. And so then we might actually have to turn him on his side just so he doesn't choke on his own vomit. So these are all just a few things in which we're worried about. But again, the main thing I don't want to happen is for him to move. All right, the club's not on fire, so there's no real need to rush him out of here. And nobody's stomping him out no more, so I don't want him to move at all, because I'm really worried about neck or spinal injuries or any actual trauma to the head. So once the paramedics get here, then we can stabilize him, and then we can get him up out of here and give him the treatment that he actually needs, which is going to be at the hospital, okay? Again, I don't ever want to assume whether or not he has a concussion or he doesn't, okay? So that's going to be something to take care of at the hospital. The best thing you could do for your patient right now is just make sure that the threat is gone, keep him stable on the ground, and then just conscious and talk to him so we can reassure our patient.